I am really happy to be here today. And my name is Linnea, as Jackie said. I work for Molnlycke Healthcare, and I have the privilege to work with a specific focus, which is patient engagement. And how can we develop resources to engage, to empower patients and nurses in the shared care practice? So we all know about the impact that living with a lower limb ulcer has. And I am here today to share with you the work that we are doing, and most importantly, how can we, moving forward, collaborate, and how can we continue to raise patient voices together. I met with Ellie a couple of years ago, and since then I visited several leg clubs, and I have to say the passion, the commitment, the engagement I felt across nurses, volunteers, members have been truly inspiring. So I'm also going to share 2 videos that we did in collaboration, and I hope you will enjoy it. This is just a simple timeline to show how we have been working above and beyond products in the past years. In 2022, we collaborated with the Patient Association to publish a report looking at the effect that COVID-19 has had on patients and nurses. Last year, in collaboration with wound care people, we worked on an initiative called In This Together Wound to really look at how can we empower patients. And this year we're launching an independent program that I will share more about, Wound Care for All, that is really with the goal to develop resources, tools, education to support you in your daily work and to support your patients in their journey. Venous leg ulcer has been defined as a silent pandemic. We all know how many people it affects. It's estimated that 1% of Western population suffer from venous leg ulcer. And its impact on daily life is severe. We're talking about limited mobility, pain, depression, anxiety. Yet only 4% receives the proper education they may need on venous leg ulcer management, and only 28% adheres on compression. So clearly there is a gap that we need to address, and continuous effort are needed to empower individuals to become the active healthcare consumer that they want to be. Patients want to be engaged, and if it's not the patient, it might be the family members who can support that patient. And often nurses lack the time and lack the tools to really and properly engage. So we have an opportunity to work together to identify the best way to engage with patients. I am going now to share the 2 videos. The first one is done in collaboration with the Dorset Leg Club, and nurses are sharing their perspective on the management of lower limb ulcer.
Huddle time, everybody! So exciting. We're really excited about that. I want to hear how you manage that.
I think people often think, oh, that will just heal. There's a lot of other factors in people's health that will stop leg ulcers healing. So that can be challenging. People who are diabetic, people who are overweight, people who are neither of those things, but still legs don't heal.
What we're aiming for those wounds to be healed within 12 weeks with the right treatment. So one of those challenges can be getting that treatment in place.
Yeah, the main challenges can be attendance, compliance with products, compression.
Kind of taking the advice on board that we've given and sort of maintaining that at home as well.
I guess with debridement, the challenge would be if it was a very deep wound, and hard slough, obviously you can't really do anything with that. You have to use a proper dressing to soften the hard slough. There are some patients who, as long as they can debride it as well and give it a good clean, if they're changing the dressing, we would try and encourage them to do that.
Some patients don't like it, debridement. Mel's seen a lot more evidence that it works really well.
I don't think we have fears around it, but maybe we have concerns about how the patients feel about it. And I think some patients are concerned about it.
Maybe initially I was a little bit reluctant, but soon found that it had such good results, debriding. It's like, if you're going to take a dressing off, there's no point just taking a dressing off, having a little look, give it a little wipe, put another dressing on. You need to kind of really get rid of that biofilm, really properly clean that wound. Whatever you can remove, you're going to treat it. Whatever you can get off, you can then treat the actual wound itself. Compression is so important.
We use bandaging, we use wraps, and we use hosiery.
Patients they just don't want to wear it a lot of the time. For a guy, he doesn't necessarily want beige because he feels it looks like ladies' stockings. Some of them are very good with it. If their dexterity is quite poor, that can be difficult. I always think anyone over the age of 40 should be wearing some sort of compression, ideally. I know.
So what motivates me is looking at the holistic person. So what do they want? So whether that's products, whether that's education, exercise, a social environment.
Seeing the education that we're giving the patients and the difference that's making to their healing, and seeing the difference it's making to their lives.
An example that I can think of is a lady that came and she needed a lot of skincare initially, and then we were able to undertake appropriate wound care and compression, and she went from being somebody that was housebound and really quite withdrawn to actually socialising, going out of the house, and wounds were healed. So it was a really positive experience.
I heard last week that £6 billion is spent on wound care in the UK a year, which actually is very similar to cancer treatment as well, £6 billion on cancer treatment.
I think we would prefer that prevention, that sort of self-care, self-awareness, self-education.
My vision for the future for venous leg ulcers would be more to do with prevention, and around education for patients, general public, not necessarily patients, for all of us.
But we now class any leg wound that's been there for 2 weeks an ulcer. It's just a word. But there's quite a stigma attached to that word. So it's education.
I hope you found this inspired, and thank you again to the Dorset Leg Club for welcoming us. So how can we work together? I think that there is really a big opportunity, and I hope we can continue. Next video is with members of the Basingstoke Leg Club, and I see Mark Farrington here. He helped us really creating the video, so thank you again for that. And these are members all experiencing venous leg ulcer since many years, sharing what it means for them.
I think it must be about 10 years now that I've had leg ulcers, on and off.
Had the ulcers, 20 odd years now.
I got my ulcers about 3.5 years ago.
He's had a number of them over the years, and probably first one maybe about 20 years ago, but the one that he has currently is the worst one that he's had.
I first got a wound because some lady hit me with a shopping trolley.
I had problems with varicose veins, and subsequently I have had ulcers.
I'd knocked my ankle and it didn't heal.
I don't want anybody to go through this. It's a pain I can't describe. I used to like going to cowboy dances. I just lived life to the full.
She's now feeling like she hasn't got the oomph to go and do those evenings.
Yeah, I suffer with a lot of leakage on both ulcers, on this leg and that leg, which ends up going and seeping through the bandages, etc. And they tend to smell, and it's embarrassing for me. When I'm here at Leg Club and they try to take dressings off, it's painful, very painful in fact.
It's difficult on a day-to-day basis watching him with the ulcer because he's not as mobile as he used to be. He gets frustrated. I don't think people really understand the pain that these guys are in and the embarrassment.
I have experienced leakage, and it has meant obviously having to have a quick change of dressings.
I try to isolate myself away So people don't have to deal with it, it's just me. My husband's really good and he'll pick up what I can't do.
First thing I want to do when it's healed is go to the beach and sit by the sea and have fish and chips and a glass of wine.
If they ever get healed, I'd just like to go out with the grandchildren for a nice long walk.
Go swimming. I love swimming and walking. So as soon as the pain is manageable, I start walking. But then as soon as I don't have to have a dressing on anymore, it's straight in the pool.
Well, I used to like wearing skirts and being able to sunbathe, stick my legs out in the sun, and really this prevents you doing that.
Every time I watch these videos, I get the same emotions, and I hope you could feel how impactful it is and how the dreams also shrinks. I mean, you're dreaming to just being able to take a walk with your grandchildren or to take a swim. So this is so inspiring for us as industry partners to really work to support and try to help these patients. It also reminds us that behind every statistic there is a person, isn't it? And behind every care plan there is a healthcare professional that strives to give the best support they can. So what we did then was to try and understand further how we could support nurses and individuals and how we could, in which direction we should move forward. So we partnered with wound care people, and we did a survey with reaching approximately 90 participants, or 90 people who all had or were experiencing hard-to-heal wounds. And when we asked them, would you like to understand more about your wound and how you can look after it? Nearly 80% said yes. This means that 8 out of 10 people want to know more. They are actively looking for more information. We also investigated what they would like to learn more about. And I'm not sure if you can read the text big enough, but it was high up on the priorities to understand how to recognize signs of infection, identify improvement or deterioration of their wound, but also how to deal with fluid, itching, odor. And when we ask them what would be your preferred way to access information, excluding, of course, face-to-face, that is always the preferred way. Well, then it came up that Google was among the highest top one prioritized, but also video tutorial, patient support group, printed materials, patient app. So clearly, we are very different as individuals and we have different preferences. So we need, as industry, to develop resources that can reach different channels. But one, I think, key learning, is that patients are eager, motivated, and resourceful. But unless we guide them, they may end up on the wrong website and follow the unsafe advice. So again, that is where I see that we can really collaborating moving forward more and more. So we then decided to partner with wound care people and do a pilot in the UK, launching an initiative called In This Together Wound. And we really wanted to understand how much patient would improve their knowledge and their confidence in wound care, and how much nurses would value this type of resource. We developed and published with them 3 magazines, one on wound care, with more generic advice, and 2 more specific for people experiencing venous leg ulcer and diabetic foot ulcer. And we really wanted to make the content simple, engaging, and accessible to reduce the stigmas the nurses endorsed were telling us, and to really make them feel less alone. We distributed 40,000 copies, and it was all distributed to nurses that shared with their patients. And the content was also available in a digital format on a website, where I think today it's more than 1,000 6,000 registrations. So when we then asked what they thought about it, we received feedback from 71 patients, and 82% felt their knowledge on wound management had improved. 68% say that it even helped them to think about changing habits, and we all know how difficult that is. And 83% state they felt the content was beneficial to better care for themselves. We couldn't be more happy to really have reached these numbers. When we asked a healthcare professional, we received feedback from 268 nurses. That was also extremely positive. Almost everyone believed this type of content increased patients' understanding and knowledge, and they find this type of resources useful to give to patients when leaving the clinic. Moreover, they would like to see this as a standard support. So how can we ensure this comes up on the formulary, for instance, here? So clearly, patient empowerment creates a positive ripple effect, benefiting patients, healthcare professionals, and industry partners as well. So what have we done with these learnings? We have now launched an independent program, Wound Care for All, Partnering for Better Healing, to support patients, family members, caregivers, healthcare professionals with hands-on practical tools, knowledge article, education to make it easier and always accessible. And most of all, it's about together in care. And I think already yesterday we stated how this cannot happen in isolation. And this is where I want the message to come. We want to collaborate with you. We want to work with you to develop resources that can have an impact and that matters. We started with Lakshmi Dunmu, tissue viability nurse in the NHS Trust in London. And with her, we are working. By the way, she won an award prize 2 days ago for her work on skin tone bias. So with her, we have worked to develop a simple tool. It's called Skin Tone Wheel, and it aims to support timely assessment on skin tone changes, to simplify skin assessment and to promote inclusive care. And this may look like a very simple tool. It is a simple tool, but yet it helps and it supports. And we've had thousands of requests just in a few weeks. With Lakshmi, we've also created a patient booklet, including a diary to help patients track their habits, but also to support that conversation between the nurse and the patients. What are your priorities? How can we follow up the results that you are achieving next week? And what short-term, long-term goals should we put down together? So where does this leave us? We know that empowerment can drive better outcomes, but it cannot happen in isolation, as I was saying. It takes all of us. Nurses, caregivers, individuals, industry partners working together. Our commitment at Molnlycke is to keep listening, keep collaborating, and developing tools that make your everyday practice a little easier and that can help your patient a little bit in this journey. So please don't hesitate to reach out to us. I have included my email here today. I would be pleased to get in touch with you if you have experience you would like to share. If you have challenges you would like us to address and collaborate with us. Today we have a stand as well here. My colleagues are there if you want to know more. So please reach out, and thank you again for welcoming us here today. Thank you.